Good morning. I'm Nancy Barron with the Robert Wood Johnson Foundation, and I'd like to, on behalf of the Foundation, thank you all for joining us today. When the Foundation began its work with Cochs in 2005, it seemed like a simple, straightforward concept. How do we strengthen the connection between care in the community and care in the jail to improve health and reduce recidivism? And of course, we had the model that Sheriff Ashe had developed and demonstrated so effectively in Massachusetts to guide us. We didn't know, we didn't realize, we really didn't understand the complexity of connecting these two systems of care. But what we were really unprepared for was the power of connecting the two worlds of criminal justice and healthcare. Criminal justice reform has been called the civil rights issue of the 21st century. It should not be surprising then that the right to a healthy life and access to health care are front and center in that debate, just as they were in 1966 when Martin Luther King, speaking before the Medical Committee for Human Rights, said, "Of all forms of inequality, injustice in health care is the most shocking and inhumane." The enactment of the Affordable Care Act, Obamacare, is going to be transformational for the criminal justice system in many ways if we seize the moment and realize the potential. And it has already begun. First, jails are uniquely positioned to bring into the healthcare system high-risk, difficult-to-reach populations who are uninsured, and therefore jails can serve as enrollment sites for detainees who are eligible for coverage. You're going to hear over and over again today, 11.6 million individuals cycle through our jails each year, the majority of whom cannot afford bail, and many of whom will be eligible for Medicaid in those states that elect to expand Medicaid eligibility for poor childless adults. Second, if Medicaid, health homes, or any system of care for that matter, wants to effectively manage high-risk, high-cost patients, the so-called superutilizers, they need to pay attention to what is happening to their members, some of whom from time to time spend time and will be treated for their health problems in their local jails, where their health problems may not continue to be as effectively managed as they are in the community. Third, many people who enter jails and prisons, particularly those with mental health and substance abuse needs, would be better served elsewhere with little risk to public safety. Diversion works, but only when there are appropriate and adequate services in the community for mental health courts and drug courts to refer to and for police to access. Coverage and the access it affords and mental health parity will be powerful tools that can be used to reform and reshape who ends up in jail. Cook County Sheriff Tom Dart's recent testimony to Congress, describing his jail as the largest mental health hospital in the state of Illinois, should be a clarion call for change that is being echoed across every county, large and small. At what point do we assert that coverage is a right to access to appropriate services in the least restrictive setting as declared under the Americans with Disabilities Act, and therefore that nonviolent misdemeanors for jail-involved individuals with mental illness should be mainstreamed into less restrictive and more appropriate treatment settings than jails? Again, the coverage that the ACA makes available to individuals who may at some point be in jail can be a powerful tool to make certain that the services that they need are available in the community as an alternative to jail. The Robert Wood Johnson Foundation's mission is to create a culture of health that enables everyone in our diverse society to lead healthy lives now and for generations to come. We cannot possibly hope to create a culture of health if the most disadvantaged members of our society continue to be left behind without any connection to the services and supports that they need to achieve and maintain healthy lives. The health disparities that exist in our communities are concentrated and exacerbated in the jail-involved population. We cannot hope to address one without addressing the other. We need to recognize, accept, and take responsibility for the fact that the majority of the people who enter our jails and prisons will return to our communities, and that addressing their health needs can be the game changer for reducing recidivism and even preventing the need for incarceration in the first place. This is about prevention, and prevention is the critical link between criminal justice and health. We started our work with Cochs in 2005. In 2007, we held our first so-called national conference. I think there were maybe 35 people around the table, and now we've connected to all of you. And it goes without saying that the work that Cochs has done to bring the field to this point has been invaluable, as I think that you will hear throughout the day. I want to personally thank Steve Rosenberg for leading this initiative, for all of the staff at Cochs who have done such a tremendous job, the Cochs board, the Burness communications team that has been a part of this from the beginning, the authors of the March Health Affairs issue, and the many, many other collaborators who are here in this room today. This has been an extraordinary journey. As you will hear throughout the day, and as you will also hear, there is so much more to accomplish and so much more potential to be realized. So thank you very much, and I'm going to turn it over to Steve.